Hey guys, thanks for watching my video today. My name is Katie and this is my reflection video for D156 for the business case analysis course to just talk about the general project, starting process, and going through need assessment, SWOT analysis, all of that, and kind of just the general reflection points of this overall course so far. So to start things out, my project that I looked into was pain reassessment scores within a PACU setting. So currently in the PACU setting, when we give pain medications, there isn't an auto-populated reassessment time frame, no matter what the medication is. It's an interesting setting to chart in because things look very different compared to an inpatient setting. So if in an inpatient setting you were to give a pain medication, after scanning it in, giving it to the patient, you would have to do some sort of reassessment. And the nice thing is that the charting functions prompt you to do that reassessment within a timely manner, which is usually within 60 minutes. In the PACU, we currently have a team that does auditing for pain reassessment scores, and those have been lower than usual. So I figured that would be a really good place to start, where we would look into different ways to improve those pain reassessment scores within that 30 to 60 minute time frame that is considered like best practices within the hospital. So to start things out, I figured that going simple with this project and allowing opportunity to expand in the future is just starting out by using visual cues. And so a lot of my research revolved around the importance of how visual aids and visual cues can ensure or improve compliance rates. So I found some decent articles both inside nursing and outside of nursing that kind of helped reinforce that even just having a visual as a reminder for people will ensure that it's a nice reminder that things will actually get done. So that would be my first piece, in the hopes of, eventually maybe progressing to having some sort of Epic or electronic health chart prompt that would facilitate some sort of reassessment score before people are dismissing. So in the PACU, it's interesting because every single patient has different recovery times. So with patients going outpatient, where we have patients that will be dismissed from the PACU and will not be staying or going to be admitted, there are some barriers to some of those things where every single recovery level could be very different. So we'll have extended recoveries that can last 6 to 7 hours. In our setting, if they were to be dismissed from our area, and then we also have people coming in for very routine procedures that is more of, a drain check or an exchange of some sort, where they might not experience even the full 30 to 60 minute recovery time, even after they receive a pain medication. So there are definitely barriers to this process. And some of the different aspects of this problem that I used looking through the affinity analysis layout was just that there's really limited education on pain reassessment scores, and a lot of times it can revolve around nurse judgment, time constraints. So things like pressures, if the PACU is very full and we are looking to get these beds turned over, there are some time constraints where you might not be able to prioritize your charting right at this moment in time because you need to focus on getting your patient dismissed. Things like back charting, just nurses forgetting, those are different things, or complicated cares can also interfere with some of these reasons that these pain scores aren't being documented. So it definitely has potential. Unfortunately, in general, changes to electronic health record systems can take time. So I figured that visual cue, whether it's, something laminated, highlighted, bright colors, something, obnoxious to be put on each of the monitors in the PACU to remind people of doing their pain reassessments. That's kind of my goal, is to help facilitate that thought process to increase the amount of pain reassessments being charted within a timely manner. So other things that I put into consideration is that right now it's not currently a huge priority. We have other benchmarks to meet in the PACU, and the pain reassessment isn't exactly the top priority. So knowing that that's kind of a weakness of the situation, that it's not currently being prioritized at Huddle, but it could be. So there is potential to kind of combat some of those things. So the weaknesses that I found in this type of project were fairly minimal compared to the strengths, which were more beneficial than not. So some of the themes that I looked at when working at this project and for this course was the different themes that were noticed in this general process. So things like workflow barriers, lack of education training, or if there was any sort of communication breakdown. So if a nurse handed off to another nurse and didn't include, hey, they're due for a pain reassessment, it might have gotten lost in translation during that swap between two staff members, or having issues with Epic and charting. So in the PACU tab of our charting program that we use, sometimes things when they're getting audited, unless it's manual, sometimes the automated auditing situations that we will run don't include certain parts of the chart. So if you plug it in one area of the charting, it might show up on the auditing, and the other end, if you put it in a different tab or a different flow sheet, it might not pull to the other auditing process. So those are things that just kind of noticed as far as the overall general process in this. So things that I looked at as far as key stakeholders would be my nurse manager. I worked with my preceptor on this and our practices committee that works with auditing and improving benchmarks for our unit, and charge nurses as well would be the key stakeholders that I'd have in mind. We also could bring in our nurse education specialist that could really emphasize and create more opportunities for education revolved around pain reassessments. So that's all that I have so far. Thank you so much for watching, and I look forward to watching your videos. Thanks.